So, former Constitutional Justice Edwin Cameron is globally recognized for his contribution to human rights and social justice. He was among the strongest critics, for instance, of the Aids-denialism policies under former President Thabo Mbeki's administration. It was in 2002 that a landmark ruling forced government to actually improve access to HIV treatment, a move that saved countless of lives. His memoir, Witness to AIDS, is one of the most hopeful personal accounts of an epidemic that's cost millions of lives. Justice Edwin Cameron joins us now via our video link for reflections on the journey traveled so far and where we're headed on this World AIDS Day. And it's a real great pleasure to have you on the program, sir. Thanks for always making time to speak to us. I think it was back in 1999 when you first spoke out about your own health status. Let's begin by just gauging your reflections, given the years gone by, about how well we've done since that moment in actually discussing the real issues around HIV.
We've done very well in many respects, Ayanda, and what a pleasure to be with you and your viewers this morning. The respects in which we've done well were the Treatment Action Campaign, which launched that very important case against President Mbeki and Health Minister Mantu Chabalala Msimang to provide treatment. I was already on treatment in 1999 when I spoke out about my own status with HIV and AIDS. And of course, that gave me the strength to be able to speak out. But millions of Africans weren't. Treatment was not available to people except privileged people like me. So Zaki Ahmed and the Treatment Action Campaign brought that case because President Mbeki was under the spell of misinformation, misstatements, false facts, and AIDS denialism. And of course, much of that is pertinent today with vaccines and COVIDs, but we might get back to that later, Ayanda. But let me just say that I was given that strength to speak out. And 24 years later, I'm still healthy and vigorous and grateful to be with you all and your viewers this morning. And of course, we now, having been through that nightmare of AIDS denialism and government refusal, because of the court case, the court led by Chief Justice Arthur Chaskelson, Deputy Chief Justice Pius Nkonzo-Langa, they gave that extraordinary order. And now, many years later, we have the world's largest publicly provided antiretroviral treatment program. Almost 6 million people like me are living this morning because we are on antiretrovirals. That would not have been achieved without brave civic activists and without brave judges. Judges, might I say, Ayanda, like Justice Sisi Kampepe, who gave 2 extraordinarily brave judgments, equally important, when she sent former President Jacob Zuma to jail just a few months ago. These are rule of law judgments which uphold the Constitution. So we can be very proud in South Africa. Another important point to make about our most successful publicly provided antiretroviral treatment program is that it's a public-private partnership. We have to pay tribute to BITS Partners to Health, to Global Care Group, who are working with the government to make these tablets available to all of us who need them. We can talk a bit, if you like, about the dark sides of the issues, but let us celebrate the fact that AIDS is treatable. It's a fully medically manageable condition. I would not be here 24 years after being deathly ill with AIDS unless that were the case.
And that's important to emphasize, especially in a context where perhaps it feels that we're not where we were hoping to be, and we'll speak about some of those different goals in just a moment. I can't help but notice, though, from the latest fact sheets from UNAID around where we are statistically speaking. So we're hearing that, for instance, in 2020, there are about 37.7 million people living with HIV. Also, though, there are about 6.1 million people who didn't know that they were living with HIV. That's a large number, and I guess from your reading, what would you attribute that to?
What we have to do is to expand testing, we have to expand access to treatment, and we have to expand delivery to treatment. But of course, we can only do that with good information and, very important, both with COVID and with HIV/AIDS, with a non-discriminatory, supportive, enabling environment. So we have to assure people that when they go to the clinic, their confidentiality will be respected, they will be treated in a proper way, and when they're diagnosed, they won't be persecuted and discriminated. One of the biggest features of the HIV/AIDS issue has been discrimination and stigma.
Right.
And that still is a feature today. So we can get those 6 million people who still don't know their HIV status. The target is 90, 90, 90. 90 people who know their status, 90% of people who
Right.
are on treatment, and 90% of those on treatment who, like me, have got a zero viral load, which means that you can come here this morning, you can take my blood, any other bodily fluid. You cannot find HIV in any of them because I'm on successfully repressed antiviral treatment. That's the goal, and we can achieve it, but we have to work to create those preconditions first.
Yeah, another ambition outside of the 1990s goal was to get to a point where in 2030 we've been able to eradicate HIV. That's what, mental maths, just about 8 years to go. You reckon that's something that's still possible?
Without doubt. There's no doubt that it can be achieved, but we can't let up. And I think we have to see the links. It's 40 years this year. On the 1st of June 1981 was the first medical public health signification of this terrible new disease, which was striking down people like myself, gay white men, San Francisco, New York, Sydney, London. And the CDC released a report on that day 40 years ago saying we don't know what's going on. And there was a lot of mystery, a lot of fear, but through medical science, they found the virus, they found its causation, they found the virology of it, and they developed treatment. We still don't have a vaccine for HIV, and we still don't have a cure. I'm going to be taking my tablets very shortly with a cup of tea in a moment when I finish speaking, but I've got to do so every day, and I've done so almost every day for the last 24 years. So through science, through level-headed belief in medicine and science, we have managed this epidemic, which we've got to reach more people. And the link with COVID, of course, is that science has worked much more quickly because we know so much more about viruses, partly because of the AIDS epidemic. And that's why they could get the vaccines out so quickly. But like with AIDS and HIV, there is tragic misinformation spread in South Africa by agents of false facts, by agents of false doubts, unnecessary, deathly, illness-inducing, death-inducing doubts. And in both these viral epidemics that have afflicted our country, AIDS and COVID, we have to fight misinformation, and we have to fight for people to get the treatment and the vaccines that they need.
And to that effort, we're grateful that at every opportunity you do put your hand up to speak about these issues. Thank you for your time. Thank you for your work. Really do appreciate you on the AIM report today. Justice Edwin Cameron speaking to us, of course, about his experience as an activist in part in the fight against the HIV epidemic. Thanks very much indeed.